Welcome to the Fit and Fueled by Faith podcast with your host, Stacy Ziegler, where I share everything faith and fitness and everything between, from women's health, hormone health, and menopause. And for today, we have a special guest, Dr. Michaela Woods, here with us today. She is dually board certified with the American Board of Obesity Medicine and American Board of Obstetrics and Gynecology. She is also a certified practitioner with the Institute of Functional Medicine, and she has certification in bioidentical hormone replacement therapy for men and women. Dr. Woods is a founder of Dr. Woods Wellness, established in 2013. She's also the #1 bestseller author of Physician Unleashed, Physician Freedom Formula. In addition to running her own independent practice, Dr. Woods also coaches other physicians and practitioners on starting and growing their independent practices. She has been a guest on Dan Kalish's podcast and featured speaker at WorldLink Medical's conference on the business of creating health. When not working in the office, Dr. Woods enjoys singing, especially gospel music. She has been a choir director throughout the years and a wedding singer for many of her family and friends. Spending time with her wonderfully supported husband, daughter, son, and close friends are her most treasured moments. Her secret ambition is to one day write a fictional book that gets turned into a blockbuster movie. Welcome, Dr. Woods. Thank you for coming here today and being on this podcast.
Thank you so much, Stacy.
So I'm looking forward, because this topic, we're going to talk about menopause and weight gain, fatigue, and more. And it's just been, this is where I've been kind of really trying to focus a lot of my attention on, and of course my audience, women over 40, who's either starting, beginning, or trying to figure out what is going on, because that was me. So kind of try to figure out like what's going on, because every time you're like, wait, what's now? Like now what? Like, and it's just like, you can't, there's not like this one like magic pill or thing that you can do that's going to solve all these symptoms or whatever we need to go through or whatever. So glad you're here. You're the specialist, you're the doctor who knows all these things. So let's get started. What is menopause and how can we fix it? And is that possible? Is there a way to fix it? I'd like to know.
Great. Yeah.
Is there a way to fix this?
Great question. Yeah. So to say fix is sort of a oversimplification, really, but let me talk about first the definition of menopause. So technically, menopause is a whole year without a period. That's for women who still have their uterus. Now, if you don't have your uterus, you can't judge it that way. And so then you judge it based on symptoms that you may be having. So that's hot flashes, night sweats, vaginal dryness, could be pain with intercourse. All of these things go along with menopause. And what is happening at that time, the estrogen production is declining. That's where a lot of those symptoms are coming from, as well as progesterone. And these are the hormones that are typically supplied by your ovaries. So as your ovaries age and decline, the estrogen levels decline, and you start getting all of these symptoms. Now, to the question of can you fix it, in a sense, and the way I look at it, Stacy, is that we want to really optimize the hormones, restoring back to the body what's missing so that you can transition through that a little bit easier. That's the way we approach it.
Nice. So yes, I've been diving into books and everything all about these hormones, like you said, for estrogen, progesterone, testosterone. And it's like, okay, where I am, in the month and stuff, because my cycle's just in whack and stuff, whether it's like 6 weeks from having like 3 periods and then 6 weeks to every other week, or no period for 2 months. And then, wow, I get my period. I'm like, so it's really, for me, like, even just, I'm even in a place right now where I can't even like really, sync my cycle, or like just, I just kind of put down when I get it and then see what's going to happen next week or 2 or 3 or 4 for 2 months.
Yes.
And then just deal with it. But I definitely feel my energy, especially, I know we're going to talk about fatigue, and that's where I think maybe most women, and just by listening and talking to other women and hearing other podcasts and just reading books. I even got a book called Why Am I Effing Tired? Because I'm trying to figure, like, why am I so tired? I just feel so drained. I'm like, there's nothing, I'm sleeping, I'm eating, I'm doing all the right things. And it's like, it can be frustrating sometimes, right? Where I'm like, okay, what's going on? And I could feel the difference of like my energy just feels like just a different low level energy. So I'm learning how to like eat certain foods for your estrogen, but like right now I have no cycle. So I'm like, not sure. I'm like, okay, I have to just I take it one day at a time, really, honestly. That's what I'm doing when it comes to all these hormones and trying to figure this out. So maybe you could explain, why are we so tired all the time?
Yeah, that's great. And also to your point too, Stacy, you may be, and a lot of the women listening, to your podcast, maybe in that perimenopause. So you haven't gone a whole year without a period, but your periods are starting to get irregular. They're spacing out. Maybe you're in your early to mid 40s. You're noticing some changes, but you haven't hit that definition of menopause. It's perimenopause, and it's kind of no man's land or no woman's land, if you will, because there's so many different things that could be happening during that time frame. As far as the fatigue, for some people, their fatigue is due to their sleep being disrupted. And again, if you're having hot flashes, night sweats, things like that, you're not going to be sleeping well. For other people, some of the fatigue may be related to testosterone, which also declines. So, testosterone is one of those important hormones that is often overlooked in the sense that people think like, well, maybe that's really for men, it's not for women, which is not true. Or they think testosterone is only related to like sexual health, which is not true either. Testosterone has some very important non-sexual benefits, which is energy, metabolism, mental clarity. And so helps you build muscle mass over time so that you burn fat more efficiently. That's what mean by metabolism. So it's not a quick fix in any way, but it's one of the dials that you want to turn in your favor, or testosterone is a dial that typically will turn in your favor if you have an adequate amount of it. And that can start to decline as you hit again your 40s and beyond. So that may be part of the reason why you're not getting enough sleep. And then just to relate it again to the hormones themselves, progesterone, and this one, Stacey, I call it my secret weapon hormone because a lot of docs kind of ignore it. They don't pay attention to it, but it has two very important benefits. One is it has a natural sedative effect. So it literally helps you sleep. So sometimes if your progesterone is declining, which it naturally does, again, when you're in that perimenopause, menopause age range, you're going to be losing that hormone. And that may be a reason why you're not sleeping as well. The second thing that progesterone does is it helps with the mood. It has a calming effect. And how many women, you may know in your own circles, again, once we're getting into this perimenopause, menopause age range, you start seeing more anxiety, more depression, more prescriptions for those types of medications. And again, some people need those medications and it's necessary. But from the functional medicine, bioidentical world, we're asking ourselves, are women with all of these prescriptions, are they really suffering from a Prozac deficiency or are they suffering from a progesterone deficiency? And unfortunately, a lot of doctors are not exploring that. So when we think about the hormones and how that relates to fatigue, first I go to is it disruption of the sleep? And then secondly, is it a decline in a couple of those hormones? And then thirdly, some of it is diet as well, and we may kind of dig into this, Stacey. And you said you've been exploring, the different aspects of your diet that impact your energy also. And, an unfortunate thing that we have to realize is as we mature, as I like to say, our bodies are going to change. So, what we were able to do in our 20s and 30s, we're just not able to do it the same. So, we have to be a little bit more conscious about what we're eating, how we're moving our body, and then also paying attention to how these hormones are playing a role as well.
Oh yeah, definitely. It's everything that exactly going through, figuring out the right foods to eat for the right time. I've been
Yes.
also doing more fasting too.
Yeah.
Intermittent fasting and fasting. I actually
Hmm.
just broke a 24-hour fast this morning, which I love fasting. It's something I've been doing and stuff, and I've heard that that helps too if you do it the right time during the right cycle. But I don't have cycle,
Hmm.
so I kind of just feel like I mean, at this point, I just throw it out. I just, like I said earlier, just try to be in tune with myself. How am I feeling this morning
Yes.
when I wake up? Do I feel? Am I waking up hungry and starving? I know it's not a good time to fast.
Hmm.
Could I feel like I'm not that hungry and then I push it, and I fast and do
Yeah.
24 or 36 or maybe a 40-hour fast, depending how
Hmm.
I'm feeling. And I love it. And it feels good and gives me the energy and stuff. Um, and so I have like my routines, not eating, 2 to 3 hours before I go to bed.
Hmm.
So my body could actually rest, so I can get that rest. And normally I have a good night's sleep, but like you were saying, once in a while I'll get those night sweats or I'll get hot. and that kind of interrupts my sleep, where I don't have a full night's sleep. And I still wake up okay, and you kind of just learn. I've kind of just learned too on those days where I'm just feeling, oh, I just push through. I'm tired. Let me go
Hmm.
for a walk because I know movement
Yeah,
creates energy, and,
absolutely.
and that works for me. So, like I said, like this perimenopause, like you say, it's like it's crazy land right now. It's like trying to figure out, once I kind of get something figured, or like I didn't have my menses for like over 60 days just recently. And I noticed things started bouncing out. And I'm like, this is good. I'm finally feeling kind of regular.
Yeah,
My hormones are not high and low and here and everywhere. I'm getting a period or
yeah.
not. I'm on luteal phase, whatever phase. And I'm just like, wow, I like this. I'm feeling like balanced. And
Hmm.
then like just the next day, I'm just like, whoa, what just happened? I feel something. I'm like, I feel like I'm in my period because I
Hmm.
just felt that shift in my energy, my hormones, right? Dip, whether it's my estrogen dropped or whatever. And I'm just like, okay, and within a week I did. And I'm just, so you start learning. So it's like, I've kind of learned, know thyself. You have to be a guinea pig. We want the secret recipe, the secret ingredient. Like we want the doctor or physician to tell us, hey, this is what you got to do. And if you do this, A to Z perfectly, you'll be fine. And there's no like secret. It's just I feel like because I've been listening and diving into this. I have you on this episode or podcast because so we could share this more. With my audience and then get your perspective because you are a physician and this is what you do for work and for your career. And just that's all I'm doing. Like I feel like for a woman, really what we can do is just take the initiative to learn, right? To be that,
Absolutely.
to I don't want to say guinea pig, but we have to do things for ourselves because there's no magic pill. Um, and we have to see what works and doesn't work. And there's gonna be some days that just whatever you're doing everything, and you're just like I just kind of learn. Let me rest. I need to
Yeah.
lay down and take a nap or just even just rest. If I'm feeling too low, or move my body. And maybe it's not going to be going doing strength training because I'm like my body. No way, I'm putting 100 pounds on my back or shoulders right now. So it's like I've been doing more Pilates and yoga,
Hmm.
and so it's finding really it's you have. I feel like if you could tell me if that's true or not. But, more of a holistic approach. I'm sure we'll get into the bioidentical hormone replacement therapy. But I'm more right now more holistic, trying to do the things like the exercise, the diet, the sleep, and all that stuff, more nutrition and
Yes.
seeing how that works with me before I kind of see, and I'm slowly starting to learn more about the HRT, because I'm very holistic and stuff. I've never taken birth control pills. I've
Yes.
never taken anything. I had 3 children, natural planning, all that kind of stuff. So, I think maybe we can maybe get into that since we're talking about that. How there's maybe been a fear, about HRT and stuff, back
Hmm.
in I want to say was it 80s, 90s, where, you know, there was just fear about taking it and stuff and about
Yeah.
cancer, things like that. So maybe you could take over when it comes to these BHRTs.
Yeah, for sure. And to your point, Stacy, just the idea of listening to your body, understanding your body, seeing what your body responds to. I think that's very important and something that I definitely support, with my patients and just, my listeners as well. It's because everybody's body is different and every
Mhm.
woman's experience through menopause is different. Some women transition through it and didn't even know it really happened. you know, and
Yeah.
other people suffer through it well into their 50s and even their 60s, they're still having hot flashes. So there is definitely variety and variation in the experience of menopause. And the thing that I, really share with my listeners too is that I'm not just about hormone replacement therapy. I'm a functional medicine doctor, which is really about root cause and natural solutions. And so
Yeah.
that's really a key to a lot of what we're doing, root cause and natural solutions. And so getting to the point of your follow-up question about like bioidentical hormones and kind of understanding really the public's opinion of that and how it has changed over the years. It was actually in 2002 when a big research study came out called the Women's Health Initiative,
Mhm.
where they were trying to determine, you know, um, do hormones really help women long term? That was really the purpose of that study. Now, as an OB-GYN, I was in my training at that time. I was a resident. And we had always been taught that once you put a woman on hormones, you should keep her on it for the rest of her life because it was beneficial. So we kind of had that understanding with other types of research, like observational research, where you follow people over time. But this was the first time where you had what is considered the gold standard of research studies. So it was double blind, placebo controlled, randomized, like all of this should be the gold standard. Part of the issue with it, though, is that they were enrolling people who had really were past menopause. So, like the average age of the women enrolled in the study was about 62 and they were starting hormones potentially for the very first time. That's not something that we do in the real world. We're starting women in their 40s, maybe in their 50s. Just to kind of sum it up, basically, and then the other issue is that they were testing Premarin versus Prempro. So this is synthetic pregnant mare's urine, synthetic estrogen versus synthetic estrogen plus a synthetic progestin or progesterone. So the study was stopped early because they saw an increased risk of breast cancer, heart attack, and stroke. And so then, sort of all in the media was this idea hormones cause cancer. All the primary care doctors stopped prescribing hormones for their women patients. And the only ones left to kind of consider hormone replacement were the OB-GYNs. Because it was our specialty. So we had to really dig deep into this. Fast forward now, 20 plus years later, a lot of that initial headline had to be reversed. There are several things, again, that they found out that was problematic with that study that doesn't necessarily apply to the women who are needing or thinking about hormone replacement therapy. Number one, it's the age in which they started. And so that we understand now that when you give a woman, let's talk about the heart attack piece of it. If you give a woman hormones early on before she's developed any kind of heart disease or plaque, then estrogen is beneficial. Estrogen has actually anti-inflammatory impacts as well. Again, it goes beyond hot flashes and night sweats. On the flip side, if you give a woman estrogen after she already has plaque or heart disease, that estrogen can disrupt that plaque. And so that was part of the issue with that study. Another issue with the progestin, the synthetic progestin that they use, that was one of the big culprits as far as the link to breast cancer, heart attack, and stroke. It wasn't even the estrogen alone. And then when you take into consideration bioidentical hormones, which they didn't, you don't see that increased risk of heart attack and stroke with a bioidentical progesterone. So it's a lot to unravel. And so it's understanding that a lot of people have been fearful. I do want to recommend a book for you, Stacey, and your listeners. If you want to delve a little bit more into this, it's called Estrogen Matters. Estrogen Matters is the name of the book, Matters. Is written by a physician, actually a male doctor, and I believe he's a cancer specialist. And the reason why he dove into, is estrogen safe or not, is because his wife was going through menopause. And so he was trying to figure out, is it safe for her to have hormones or is it not? And so he really lays out the data and talks about hormones. And I think another important thing for us to point out, Stacey, for your listeners, is that when we look at hormone replacement therapy, it has so many benefits beyond the symptom relief. Now, because of that study, the Women's Health Initiative, their recommendations then over the last 20 years was use the lowest dose for the shortest amount of time possible just to alleviate symptoms. Just recently, one of the national medical societies related to menopause and hormones, they said you shouldn't set a time limit anymore on hormone replacement. It needs to be a conversation between the patient and her doctor. So they're starting to reverse some of that opinion. The other thing that comes out in the book, Estrogen Matters, and again, some of these things came out in the Women's Health Initiative study, that women on hormones, particularly estrogen, again, even the synthetic, which I don't even really recommend, you saw a reduction in osteoporosis by about 30%, meaning you're going to have less, women breaking their hips. And if you or anyone knows if they've had a mother or a grandmother who's broken their hip, studies show that their health in general tends to decline very rapidly. So bone health is super important as women are maturing. So if you can find something to reduce osteoporosis by 30%, that's very powerful. Another thing that, again, even came out in that study reduction of colon cancer by about 30%. And when you look at the leading causes of cancer in women, breast cancer, lung cancer, colon cancer are the top three. So that is significant as well. And then if you take the Women's Health Initiative study aside and look at all of the data prior to and after, especially like long-term observational studies, there's one called the Nurses study, 30 to 50% reduction in heart disease in women who are on hormone replacement therapy. So there's so many benefits. Again, they don't recommend that we give it for the benefit, but again, there are so many benefits of hormones beyond just the relief of hot flashes and night sweats. But even the amount of time, Stacey, that has taken me to kind of address that question, you can see that it's complex. And so it has to be a conversation between the physician and the patient. You have to address, and this is what I do, I address the fear. So if there's fear about breast cancer, if there's a significant history of breast cancer, then we take, the hormones that are really of concern are estrogen and progesterone. So for some of those women, I take that off the table. Let's talk about testosterone then, because there's no association with cancer. There's really no concern there. And there's other benefits of testosterone. So there's different ways that we can handle it. But, again, just the complexity of my answer tells you that it's a pretty complex question. And it's been something that we've been dealing with over the last 20 plus years. A lot of it has been reversed, but the thing that made the headlines was the very first bit of information that came out. And that has stuck in the minds of both physicians and patients over the last 20 plus years.
Wow. Yeah, there's a lot, and I know they're still studying stuff because, I mean, what I've heard and stuff from podcasts and other people I follow and stuff is that like women's health, I think it's only been maybe 40 years that they've really been studying women. Like a lot of researchers have been men have been used because they
Hmm.
really didn't test on women because of our hormones, right? Our cycle is always
Yeah.
different. And so there's not a lot of studies, but there's new things coming out and stuff slowly but steady. I think people are becoming more aware. I'm seeing it, I don't know, maybe because I'm in it, but I feel like everybody's talking about this now.
Yeah.
Like,
Yeah.
is it maybe because I'm just aware of it? But I'm just like, wow, everybody, I think I saw an actress trying to put out a menopause something bill for some state. I'm like, oh, wow. Like, maybe because everybody that's on social media is probably like, they're 40, 50s now. I don't know, but I'm just like, wow, it's everywhere and everyone's talking about it. And of course,
Yeah, for sure.
that's what like my main focus right now because I'm in it. And as a health fitness coach, I I want to know what I can do. I want to know what I can do for myself and then how I can help my clients and my people,
Hmm.
my circle, and then share it. Since I'm already kind of
Yes.
in the fitness industry, okay, what is this? Because I'm sure like I have friends and family that are like my age. I actually have a friend. She's like, I don't know what's going on. I saw her at the doctor. It was funny. Both I came out my OBGYN appointment a couple months ago, and she's sitting there. I'm like, how is this the same time, same day? This appointment. And she started talking. She's like, I got to see my doctor. I'm like, what? She's like, I don't know what's going on with me. I'm like, well, probably going through perimenopause. She's like, oh my God, I don't know this and this and that. I'm like, okay, we'll talk to her and, I'll
Hmm.
talk to you soon. And then,
Yes.
and like you said, everybody's different because I have another friend who's closer to my age. And it's like, I'm like, no symptoms or nothing? You have no, she's like, no. I'm like, huh? So I don't know if there's a thing because she's never had children and I've had 3 kids.
Yeah.
So
It's interesting. I don't think that we have any data related to childbearing and the experience of menopause. One of the best things that we have is sort of a benchmark is really to talk to other women in your family to
yeah,
understand how they experience it. So we always tell women, hey, if you have older sisters, find out what their experience was. If your mom is around to talk with her, ask her what her experience was, because oftentimes your experience will be similar. Now, there are definitely some things on the natural side that you can do, and I'll touch on some of these, and this is probably, some of the things that you talk about too, Stacey, with your audience. But looking at your diet is super important. There are things that I call menopause pretenders. So there are things that may be triggering symptoms that feel like menopause, but are not. And these are things that you can have a direct impact on. So one of the menopause pretenders is sugar. Okay.
yeah,
Because what's happening is when you get a swing in your blood sugar, so let's say you have something sweet you're going to get a spike in your blood sugar, and then you're going to get a drop. And what happens is your body is like overcorrecting, trying to get that sugar out of the bloodstream and store it away. When it overcorrects, you've got a dip that could bring on sweating. So sometimes when you're thinking, oh my gosh, I'm having hot flashes because I'm menopausal, that might be the menopause pretender of sugar. And
Oh,
directly
okay.
related, and you know, a lot of times if you're going to be snacking, that sugar's happening at night, right? That sugar intake's happening at night. So you go to bed, that blood sugar drops that happens in the middle of the night. You wake up, you're having hot flashes. Well, it wasn't really necessarily a hormonal thing. It was a blood sugar thing. Or if we say it was hormonal, it was insulin, not estrogen. Another direct link to that is alcohol. So you know
Mhm.
how women, you know, a lot of women want to have their
Yes.
wine at night because they feel it like it relaxes them. You may
Mhm.
have that immediate impact, but again, in the night, the blood sugar goes from up to crashing down. Your body has to wake up to get the blood sugar back up. It causes sweats. So be aware of those menopause pretenders. And at the same time, Stacey, that really points to what are some of the things that you can do naturally to kind of alleviate or reduce the severity of the menopausal symptoms that you're having. Reducing sugar for sure, reducing alcohol, reducing inflammatory foods. The top culprits as far as inflammatory foods are going to be sugar, alcohol, gluten, dairy. These are the big ones that are known inflammatory. Trying to stay away from processed foods with extra additives. If you can start to eliminate some of those things in your diet, getting in a good amount of protein, again, to keep your blood sugar steady, these are the natural things that you can do to reduce or you know, diminish whatever menopausal symptoms you're having. Another thing that goes along with menopause, Stacey, is the mood, right? Up and down.
Yeah.
Understand that if your blood sugar's fluctuating, that's going to exacerbate the mood swings. So
Mhm.
that's
Yeah.
how important the diet is. And then certainly trying to get in a good amount of sleep. Those are some of the simple things that you can do. You are a fitness coach. Exercising is so important. They've even shown studies, you know, I know you're aware of this, but I'll just say it for the audience. They've shown studies that exercise can be as effective as an antidepressant
Mhm.
as far as your mood is concerned. And what are the things that happen during the perimenopause and menopausal years? You've got fluctuations in your mood. Exercise can help with that. Exercise can increase your body's ability to make testosterone. So there's those are some of the basic things that you can do to really make this transition a little bit easier, even if you're not exploring, you know, hormone replacement therapy.
No, that's awesome and good that you shared that. Thank you so much because I have 2 daughters. I have 3 children, but 2 daughters and a son.
Hmm.
And men should understand this too and learn everything because I'm always sharing with my husband so
Yes.
he can understand me and know like it's not
Right.
you, it's me, right? But
Hmm.
but they have expressed so my youngest is 20 and she said she's gotten like hot flash or something, you know, and then my
Hmm.
oldest daughter is 28 and she says like when she gets her period, she gets like hot flashes. And I'm thinking, okay, and I'm in my 40s and I'm going through this. I'm like, wow. So from 20 to, and then my mother, who's going to be 70, you know, once in a while, she'll get the hot flashes too. So I'm like, wow, what is this from 20 to 70? But now that you're saying that these mimics of
Hmm.
menopause symptoms, you know, based maybe on sugar, you know, and other factors and stuff, you know, during their period. I mean, have you heard of that?
Yeah.
Like besides
Yeah.
menopause,
So,
premenopause, women
yeah,
like
for
at a young
sure.
age? I
So,
mean, my youngest is
yeah.
on birth
So,
control, so that's throwing her off probably.
yeah. So, if you're on a birth control, your hormone levels should be pretty steady, except for if you're doing that placebo week, then you have no hormones. So, the way our bodies respond, whenever there's a drop in hormones, that's when you really feel a significant shift sort of in your well-being and in your mood, etc. That's why right around the time of the period, that's why the PMS happens,
Mm,
the premenstrual syndrome,
yeah,
where women can get irritable, start crying all the time, and you're like, it's
that's
I
me.
don't know. Yeah, like you
I'm
tell
very
your husband,
emotional.
it's
I
not you,
cry
it's me,
all the time.
right? What's
Yeah.
happening right there is your hormones are dropping. That's what happens right when the period starts. And so potentially that drop in the hormone may cause a little bit of a sweat because it's a decline in the estrogen level if you're having a sharp decline. So that's potentially part of it. But yeah, when you're right at the time of your cycle, that's when your hormones are at their lowest. And from, let's say, a week before your cycle until your cycle, that's when you're having that sharp decline. And that's when you can sometimes have very instability in your emotions and things like that as well.
Oh yeah, definitely. I definitely know when I'm like a luteal phase or like I'm starting to learn what the sweats like since I didn't have my period for like over 60 days, whatever recently. But then like I said, I just felt this like the next day, my energy and this and that. I'm thinking, I feel like I get my period. And then I had like usually happens like 2 to 3 consecutive nights where I just like a hot sweat or just like I'm like sweating hot and I'm like, I'm gonna get my period because I've noticed, like I said, keeping track and knowing these things, for
Yeah.
women, listen, ladies listening, get a notebook and write down your symptoms when things happen so you can at least get an idea. So I've kind of learned this pattern and I got these sweats maybe 2 or 3 nights, and within 3 days I got my period. I said, okay, I'm learning this. That's like my, and
Right.
this is my PMS. Like get these sweats,
Hmm.
my energy drops, these sweats at night, can't sleep, and then boom, got my period, right? So yeah, it's crazy. It's really just knowing everything. And then, like you say, I think like when you mentioned sugar and alcohol, my goodness, definitely. Like I think why the younger girls are starting to get more of these symptoms and stuff because it's our food and our diet. And
Hmm.
from alcohol, my mother will tell me if she drinks a glass of wine once in a while, that will trigger her to have a hot flash. So she's
Yeah.
aware. So again, it's that awareness, being aware of what are you eating, what are you putting in your body, what's your sleep like, are you drinking enough water, are you moving your body, all these things, are you doing those things, to start with that, and if that's not working, you talk to your doctor and see, if HRT is something that you need to take and stuff. So that's where I'm like doing all the holistic stuff, right? Doing all the
Yes.
fitness, eating right, just trying to get the good sleep and fasting and all that stuff, and see if I need that stuff, and learning at the same time too, because I like to make sure if I'm putting something in my body. And maybe we can talk a little bit about it. You mentioned testosterone we can make. So I do have a question, like how does our body make like hormones,
Yeah.
versus
So most
the
of
bioidentical, you know, um, hormone
yeah.
replacement.
So the top three hormones that we've talked about, estrogen, progesterone, testosterone, primarily it's coming from the ovaries. And your ovaries, just as they mature, they decline in production. So that's part of that. Definitely working your muscles helps your testosterone, particularly, but it's primarily coming from your ovaries. And again, as the ovaries age, they just decline in that production. And
Within
so
like
the
50.
way I look at yeah, the way I look at bioidentical hormones, first of all, let me define that. So a
Please.
bioidentical hormone, yeah, it just means it has the same chemical structure as the hormone that your body naturally produces. And so when I think about natural solutions, I put bioidentical hormones in that because I feel like one of those natural things you can do is just give your body what it's missing. And what
Mm,
it's missing, again, as those hormone production declines, you can give that back to the body. So again, it has the same chemical structure. Some bioidentical hormones you can get commercially prepared, like at your regular pharmacy. Some bioidentical hormones are compounded at special compounding pharmacies. And I use both with my patients. With compounding pharmacies, you can really individualize the dosing a little bit more than you can the bioidenticals that are more standardized. So that's some of the differences there as far as the two. So hopefully that helps with that answer.
okay. Yeah, definitely. Because I know you were talking about synthetic, and then that's something I would never, I would not want to do the synthetic. So the bioidentical is more, it's closer to the natural hormone
Yeah,
itself.
it is the same chemical structure as what your body produces. That is right.
Okay. So now you can explain to me, because I've also heard, so there's, okay, so we got that now, different ways of injecting it, or I've heard like topical
Yeah.
creams, or you can
Oh yeah,
inject it,
yeah.
and like, is
Uh-huh.
there a difference or safer versus not safe?
Yeah,
If
great
anything,
question.
I heard about the cream, like at least a cream is a cream. I don't have to ingest it, so maybe you could
Yeah.
explain the difference or not, or if it's a preference or not.
Sure. So, with most hormones, in general, we like to give them non-orally so they can not have to go through the whole, there's called a liver effect that we try to bypass. So that's why
Okay.
a lot of these modalities, I'm going to explain them to you. Most of them are not oral, like going through the GI tract. Usually we're trying
Okay.
to avoid that with these hormones. So there are creams. something you apply, and you could do estrogen, progesterone, testosterone in a cream. One of the disadvantages sometimes with creams is that it can be messy for people. People absorb it differently. I'm giving you my opinion. It's not my favorite. What is not my opinion, but fact is that the progesterone, when you do it in a cream, you can't really get a good blood level of it. So it's not preferred, especially progesterone. And again, that's the one that I call the secret weapon hormone that can help with energy,
Mhm.
help with mood. If you want to get the full impact of progesterone, you need to take it in a different route. There are some oral options for estrogen and progesterone. As far as safety, the oral estrogen has the highest risk of potential blood clot. Estrogen just is a little bit of a thrombotic hormone, meaning it has an inherent risk of clot. Even you may have heard stories of young women, say on a birth control pill, that could have, a blood clot. It's pretty rare. But again, even on a birth control pill, we've seen that happen. So we just know that is the case with oral estrogen. And so the other modalities of estrogen have a lesser uh, risk of a clot. And by clot, I mean like clot in your heart, clot on your brain. Okay. Clot in the heart is a heart attack, clot on the brain is a stroke, basically. So the highest risk is in the oral. But what's interesting though is that some of the best benefit related to, say, your cholesterol panel and other things you see in the oral estrogen. There are also a modality called a troche, Troche. The troche is like a throat lozenge. You just hold it in your mouth and it's dissolved. So even though you hold it in your mouth, it's not going through your GI tract. That's not the idea. It's
Mhm.
absorbed through the cheek mucosa and into the bloodstream. And that modality, you take it every day, and you could put, all three of those hormones in it. There are also injections that some physicians offer. I do offer injections in my office.
I was
That would
gonna
be estrogen, yeah, estrogen and testosterone. With those injections, you can really dial in the dose very specific to the individual. It's a little bit more potent. We do it every 2 weeks for women, weekly for men. I still keep progesterone as a troche at night because you want to get that sedative effect. And then there's a modality called a pellet. A pellet is like a little compressed powder of hormone, like the size of a Tic Tac or smaller. That is a procedure. So you come into the office, we make a little tiny incision, probably, nail to nail, if you were maybe like a quarter of an inch in the upper outer buttock area. And you place those pellets into the fatty tissue, and they're slowly absorbed in the body over the course of 3 to 4 months. For men who get pellets, they can get it either in the buttock area or in the love handle, which is, that little spot you can grab above the waist.
Mhm.
You can place the
Yeah.
pellets there. And for men, their pellets are good for about 6 months. So they only have to do it twice a year. For women, they only have to do it 4 times a year. And it's nice because you get a nice steady state of hormone. So I do like pellet therapy. I don't like to start with pellet therapy though, Stacey, because we want to get a sense of how people are going to do on the hormone, what kind of side effects are they going to notice. And when you get a pellet in, you can't take it out. And so, if you're looking for those who are interested in bioidentical hormones and looking for a physician or a practitioner, make sure they have different modalities. Like if they say we only do pellets, I'm a little bit wary of that
Yeah.
because I would want to know that there are different options. You want to have different options for people. And I said side effects, so let me talk about that a little bit too. So with estrogen, potential side effects could be some breast tenderness for women. Again, because you're kind of going from nothing to something, so you're going to notice a few things. You're going to notice the benefits. You might notice a little bit of breast tenderness. If you have a uterus, you could notice a little bit of spotting or something like that. But if you take your hormones regularly, that should be pretty minimal. With progesterone, saying you can notice a little bit of breast tenderness, a little bit of spotting. That typically works itself out, once your body get used to it. And then on the testosterone side, for women, about 5 to 10% of women may notice some oily skin, a little bit of acne. Some women may notice a little bit of facial hair. Nobody's growing a beard or anything, Stacey. Nobody's voice is changing or anything like that. But you'll notice some of those small things. And it's always a matter of when you're working with your physician or practitioner, you want to be balancing benefit versus side effect. So you want to be having an ongoing conversation. How are you feeling? What kind of side effects are you noticing? You want to be checking labs regularly so you can see what your lab work looks like as well. So it's really an ongoing process. And we do a lot of close monitoring. And I would say that too, like when you're going to a bioidentical hormone specialist, functional medicine doctor who does hormones, we do things differently. Traditional doctor you see once a year. If you've got chronic conditions, maybe twice a year. We really follow people a lot more closely because of the things that we're working on and the way that we're managing them.
Oh, wow. Now I have a question for you. Okay, so you're mentioning we got the hormones, which are the three sex hormones,
Mhm.
estrogen, progesterone, testosterone. Women can make more testosterone by exercising, but your estrogen just falls short because our ovaries getting old, and then there's no way to replace that naturally. Um, and so I guess with this bioidentical hormone replacement therapy, do you have to have all three? Can you just be on one, or they recommend a balance of all three of the hormones? Like, I guess, is it based on your symptoms where you're needing more estrogen or progesterone or testosterone? Can you
Yeah,
explain?
that's a great question. And so that's where it becomes very individualized. And so that's where I believe lab work is important. I think that's a first step. That's what I do first. We do a comprehensive lab panel looking at hormones, inflammation markers, all of those things, because I'm going to take you, for example, Stacy, and I don't even know your age or anything, but let's just say a hypothetical Stacy, okay,
Right.
who's,
Yeah.
maybe 45. She's noticing a little bit of hot flashes, but she's having periods every 6 to 8 weeks. If I look at your lab work and if your estrogen is in a normal range, even though you've had hot flashes, I don't want to give you estrogen because your estrogen is still fluctuating. And if I give you estrogen just because I caught it at a low point, later in the month, you may be hyperestrogen, right? And then estrogen when it's in excess can actually be fat storing, so we don't want to overshoot. And
Is-
so estrogen is really the last thing you add, especially a woman in her 40s, because she's still making estrogen on her own, and she's making it cyclically, randomly. It's
Yeah,
not always
everywhere.
predictable. Right. And so the ones that we start with are going to be progesterone potentially, because you want to get that steady state from mood and sleep, and testosterone. And again, like I mentioned earlier, if there's a woman who has a concern about, cancer or breast cancer, then we take estrogen and progesterone off the table and we start with testosterone. The other thing that's neat about these hormones, Stacey, is let's say progesterone. It has a chemical structure similar enough to estrogen that sometimes progesterone can actually help with hot flashes, even though traditionally we think that's only estrogen. Or take testosterone, for example. What happens in your body is that a little bit of testosterone actually converts to estrogen. So we can sort of address that without giving estrogen directly. And so that's how men make their estrogen. So men have a little bit of estrogen, believe it or not, and it is converted from their testosterone because men need estrogen for their heart health and bone strength too. And they convert it from the testosterone that their body makes.
Wow, amazing. I always find it fascinating, the human body, how like amazing we are and how God created us. And of course, there's
Absolutely.
times like, God,
Yes.
you created women like this, so maybe am I going to just like, I don't want to say be a saint because like every woman has gone through this, and I feel like no one's ever talked about it because I'm like, it's just so weird. Like, I don't know if like women just accepted it and stuff, and we're more vocal these days because social media, we got to
Yeah.
express the way we feel and what's going on with me.
Yes.
Um, that it's something else, and so that's why sometimes I'm like maybe I'm just gonna deal with it because it's my symptoms are really not bad at all. If I'm a little tired, I eat, I move my body, and I feel fine. Like because I know like
Yeah.
energy is fitness, but like movement creates energy.
Mhm.
Um, and as for hot flashes, my how it's worked for me. It's the weirdest thing. Have you ever heard any other clients explain it this way? I don't get them randomly. So the first set, I like to say set, the first set or session of hot flushes, I heard somebody say hot flushes too, was not this year, but last January was the first year. And it was like, it lasted about 6 weeks. I said, what is going on? And it was like a 6 week thing. It was like during January, we're watching the football games and Valentine's Day. I'm like, to my husband, like, I'm gonna have flash. I'm like this, behind, we're lifting my hair up, fanning my neck. I'm like, what the heck's going on? And then Lent season started, they just disappeared. I'm like, what the heck?
Mhm.
Okay. I'm thinking anything gonna come back? And then nothing. And then this year it was like it kind of left where it picked up where it left off. So not quite in February, but like right before I got my period, my menses, it was probably like a week I started getting a little hot flash. I'm like, what's going on? I'm thinking, okay, I've had these like in a year, over a year. And the same thing, this lasted about 4 to 5 weeks. But it
Mhm.
didn't seem as bad as the first episode that I got. The first time it was like like where I felt that like the furnace, right? From like within and to go up
Mm.
my face turned red and the
Yeah.
sweating. This felt like it was like if you ever exercise and you get hot and you're like, oh, I'm so hot now, I gotta take off my sweater, you build up that
Mhm.
heat. It would just happen like that. So I'd
Mhm.
get hot and I'm like, oh my goodness, I'm having a hot flash. It wasn't like where this felt this more like this flood of like blood or something, heat go through from the lower to upper. And if anything, I'd get more like I felt like a little sweat. Like you ever get like a little fever sweat
Mm.
where like my
Mhm.
forearm, like tell my husband, like, see, Phil, I feel clammy, sweaty, and then it go away. And it would happen sometimes a little throughout the day here and there. The first time I had it, it was always mostly more in the evening. It was like during dinner or when I finally wanted to sit down and relax. I get these hot flashes. I'm
Mhm.
like, what the heck's going on? So that's how my hot flash, I don't get them randomly. I got them that one time for 5, 6 weeks and then just finished, I think, mid April. I got them four, five,
Mm.
6 weeks again. And I'm like, that's so
Mhm.
strange. And I'm like, trying to think of like, did something trigger that? What was going on in my life for those few weeks?
Yeah.
And then I'm
Yeah.
fine. I'm like,
Eh,
okay.
yeah, and, we
So
didn't even
it's
talk
so,
about how stress plays a role in all of this too, so
I know we didn't
and
talk
I
about
think
that.
it's
Yeah.
hard to yeah, it's hard to quantify. Each woman is, different, each body is different, and to your point, God created these amazing bodies. I always tell, my clients and patients, your body is divinely designed and has a great capacity to heal, so we just have to remember that, even in this entire process, whether you're doing completely just natural lifestyle changes or whether or not you incorporate bioidentical hormones, your body is set up to heal and to really, work for you, not against you. You got to kind of remember that, and stay encouraged, even in the
Exactly.
process of the unknown that, you may be dealing with.
Amen. And it's almost like I feel like it's that unwavering faith. It's like we don't know what's gonna happen tomorrow or next week, or if I'm gonna get enough hot flash in another session or segment or whatever is gonna come. And it's like just living like day to day, waking up and being thankful. Okay, God, I'm healthy, I'm alive, I'm breathing, I'm alive today. Whatever you send
Yes,
me, I'll take with patience, strength and courage. Be my strength and courage and all that stuff. But it's like
absolutely.
exactly, it's like, and it's like the uncertainty of the future. Like, we can't control the future. And it's almost like with this too, we really can't control this, unless maybe, you do get on the BHRTs and stuff like that, where you have more balance and and your body's balanced once again. But yeah, it's just taking for me, it's just taking one day at a time. Like I said, I don't feel like my symptoms are really bad. I don't have the emotional swings. I don't get moody, irritable like that. I think a lot of my faith helps me that because I'm always like constantly praying. I've
Yeah.
learned, my children taught me patience stuff. I'm not one of those people, even when I used to get like, had a normal cycle and stuff, not really, I could feel maybe getting a little irritation stuff, but I wasn't like that person that screamed again, ballistic or nasty, mad and blow up and like, I'm very calm
Hmm.
and patient. I always say, thank you, God. Like, hopefully it continues that I'm able to like take, like, even when I would get a hot flash, I would take it as like, okay, let me be a saint. Let me just like, as penance, like, okay, just breathe, meditate. I would meditate and breathe through like a hot flash, and just
Yeah.
like
Yeah.
give it to God. Like, this is nothing compared to like what he endured and
Hmm.
suffered for us. But so you find ways, whether if you want the
Absolutely.
HRT, and if that you feel like you can't handle these symptoms and stuff like that, and you want like your old life back, because I know people wake up like, what happened to me? I don't feel like my old self. And I've gone through that where I felt a little depressed. I'm like, I just don't feel like myself. You could see, even the weight, really, we didn't talk about the weight gain, right? There's the weight gain and stuff. And it's like, you try to like, I'm doing this, I'm doing that. And why, I've gained like 5 pounds in like 2 months, or is it water weight? Is it this and that? And it's like doing what you're doing, being aware of, okay, do I need to cut something out? Because sometimes people think, okay, I got to work harder. I got to work harder. I got to starve myself more. And it's like, I'm learning for my age and stuff, I'm going to be 50. And it's like, so like I said earlier, like, I'm learning instead of going hardcore. I used to jog. I don't do that anymore. I replace that with walking now, like every day. I love walking. It's
Hmm.
therapeutic. It's like just good for mental health. Um,
Yes.
Yoga, Pilates, like more lower impact. I still do like kickboxing and then like strength training. I went away for a week and then I kind of really haven't got back to, I did like maybe one day where I lift a heavy deadlifts and stuff like that. So making sure I still get my strength training and then my protein.
Yes.
So I'm all about
Yeah,
that,
for
moving my
sure.
body, get my strength training in. But if I'm, like I said, if I'm feeling like I don't feel like I'm gonna lift heavy today, my body's achy or whatever it is, I listen and then do something low
Yes.
impact, go for a walk. But the thing is, I'm always moving. I'm on my feet. Don't let this bring you down. As much as you feel like I'm tired, I don't do anything, you feel lethargic. I would say, don't let that bring you down. Like you can always muster strength to go for a walk. And once you get outside, you just start feeling good. And for me, I've noticed when I'm moving my legs, I feel good. If I'm having like my lower back ache or something, just moving my body, even this summer, winter time. I went skiing and I was having, because I usually when I get PMS or something, I get the lower achy back symptoms,
Hmm. Hmm.
and so we were skiing, and every time we sat on the lift, I'm like, oh, my back, I'm like trying to twist and stuff. But once I got on the skis and skiing down the slope, I felt amazing. It's just like my
Hmm.
body's moving. That for me,
Yeah.
movement really helps me mentally and physically. So just try to, push through and move your body. And like I said, and if your symptoms are so like that bad, definitely talk to your doctor and see how they can help you, because, I hear the stories, people like, where has this been my whole life? So, it's, everybody does what they need to do for themselves. And I'm in a place where I feel like I don't think I need the hormone replacement quite yet. I guess what I'm saying, I could handle my symptoms.
Yeah.
I don't feel like they're extreme. They're not bringing me down. They're not destroying my life. I'm just
Hmm.
kind of just learning different ways of doing
For
things,
sure.
without having to do that. But if you're like feeling like you're trying everything and it's not working, then yeah, definitely maybe HRT might work for you. Like you said, there's something for everybody, whether it's holistic, functional medicine, or, BHRTs.
Absolutely. Yeah, there's so many different options out there, and you just have to see what's right for your body. And I think you hit the nail on the head, Stacey. There's a lot of things that you can do naturally. And it's kind of like you gonna if you reach a tipping point. That's the people that I see. They have like, they're frustrated, they're fed up, they've tried everything, and it is really kind of really disrupting their life in a significant way. That's usually
Yeah.
when they come to see me, for sure. Kind of where you are right now sounds like you're on a great path and managing it, as you should, with all of those important lifestyle factors that we've talked about. Then that's the way to go. And then when you need a little bit more help, then you come to see, a specialist such as myself, where we do functional medicine and bioidentical hormones.
And I just want to say this last thing too. Like I said, do the holistic things. You're doing everything. And if you're not, don't think that, oh, let me go on this hormone replacement and it's going to solve everything. Definitely think, look at your lifestyle, because you still want to make sure
Right.
you eat the right foods for your body to take care of your
Hmm.
temple, right? That God gave us, and get into sleep and stuff. There, no, just because there's HRT and maybe, yes, it could help balance you. But I definitely would recommend, if you're not doing it, to definitely implement. And I've talked in my past episodes, things that you can do, getting the sleep and drinking the water and moving your body and exercising
Yeah.
and eating the right foods, again, avoiding the sugars, alcohol. I mean, these are things that make common sense that we should do anyways, as we mature, just to take better care of our body and be aware of the foods and things we're putting and consuming in our life, not just even food, but like in our environment, the stresses in our life. How can we
Yes.
eliminate the stresses and the things that cause us to feel sick and this and that. Um, so don't just look at HRT as like this one miracle drug, but to also, if you're thinking and considering it, to also implement all those other healthy lifestyle habits so you can just generally be healthy, strong, and fit moving forward into your next stage of life.
Absolutely well said. And it takes a comprehensive approach, comprehensive lifestyle, whether or not you do hormones, addressing your mental, spiritual, and emotional well-being. I address all of those things with my clients, so I couldn't agree with you more, Stacey, on that.
Well, thank you so much. So, before we wrap up, is there anything else that you want to share that maybe we forgot? Because there's so much we could talk about. Is there anything else
Yeah.
that you feel that we missed or you want to share with the audience before
No,
we
I
wrap
think we hit
up?
a lot of great things. Yeah, I do have a free guide if folks want to get that. It's called The Three Secrets to Hormone Balance Every Woman Should Know. It's drwoodswellness.com /guide. And that's something that we can make available to your listeners again,
Yes,
and
definitely.
I'll share
Great
it with,
information. I'll put everything in the show notes. You said the book, Estrogen
yeah,
Matters. We'll link that and then also your guide too. So then, yeah, the audience can have that
yeah.
free book so they can, they can dive into if they're not, if they're there and they're figuring, yeah, I've had some symptoms and this and that. Let me
Mhm.
learn into this, or they've been going through stuff and it's all clicking like, oh my goodness, I'm going through perimenopause. Because one thing I know we
Yeah.
didn't talk is that perimenopause can start like in the 30s, 30s into
Yeah,
your
I can start
40s. So,
early.
and like you say, some people will go through it and realize, oh, I didn't feel any symptoms, or that, they are aware of certain changes in their life. But yeah, so definitely I think even for my audience, if you're over 40 listening to this, if you have daughters, you have anybody, even I think in the youth, just start being aware of their body, learning their cycle. I think, because there's ways that you can have a better period too, learning when to eat for your cycle, exercise for your cycle, all those good things for your cycle, just to take care of yourself, because we go through different phases, from puberty to what I'm learning now. And I wish we learned this stuff in school, even just
Yeah.
our cycle in general. I started learning
hmm
cycle syncing like each couple years ago. And it's like, okay, just when I started
hmm
learning that, I'm starting to go through perimenopause. I'm like, great. So I definitely recommend, if I have any young listeners listening, or like I said, if you have daughters or anybody that that's young, to start these good habits now, right? To be aware of your body, because we only have this one body, this one temple that we've been given and blessed, that
Yes.
we are the ones who have to take control of it. No one can hand you this magic pill or this, or no one's going to step into your body and say, okay, this is what we have to do. You could explain to a doctor what you need to do, but you know yourself better. And so what better time in your youth to start learning yourself,
Yeah.
taking care of yourself, because this is eventually going to happen to you. You're going to go through this phase, and it's not where it's scary. I think it is scary when you don't know these things, right? When we don't know what to expect during our menstrual cycle, or we don't know what to expect during perimenopause or menopause and all these things in life, it could tend to be scary. But if we can educate ourselves and be informed, then you're going to go into this saying, this is part of life, this is another phase or chapter in my life, and then it's easier to accept and embrace. But I think when you don't know and you go at it with fear and confusion,
Yeah.
and that's when you're just going to be like, you're going to be hitting the ground, like not knowing what to do, and just it's going to be harder. I guess you're going to have more stress in you, versus that's one way to ease the stress, is by learning, right? Educating yourself when you're younger and doing things you need to do now for then. I think people wait, oh, when I get older, like, no, no, no.
Right.
Start now. And even if you're still in your 40s and you have young kids, start your kids young. Teach your daughters, teach your
Yeah.
sons about how to respect their body and to know their body, to be aware of how their body works and stuff, for both men and female. I think men, I said earlier, I think it'd be great if men knew this, because they could understand their wives. I think there'd be less divorce
Mm.
rate, because I think a lot of divorce probably happened in the 40s when women are going through this. Men are thinking what's happened to my wife.
Mhm.
I know there's
Mhm.
a family or a friend or somebody, my family, where they're around the same age. And I think the wife's like, and I think she's going through this, but she's having more mental health issues and stuff. And the husband's like,
Mhm.
I don't know what's going on. She's like a totally different person. So I think everybody needs to be educated and be more sympathetic toward women, instead of like, oh well,
Yeah.
what's wrong with you, you got your period, or suck it up, why are you always tired, like, you know those are the worst things for men to say, and this that. So I think definitely men need to be educated in this as well.
Yes.
So start teaching your sons, your boys, your girls, everybody needs to be informed how a man and woman's body function, so we can then work together, love each other better, and understand each other, versus blame each other, or why are you acting this way or that, and thinking something's wrong with you. And then, and even just for women too, because I think, years ago, just through my period, my cycle, I would feel sometimes bipolar. I'd be like, why do I feel this way one time in a
Mm.
month and why I feel this other time? And I wasn't aware of these hormones, estrogen
Yeah.
and this and that, they have different effect and play on your energy, and even like your creativeness, and even like how way you feel. Like one minute it's like, I love you, and the next minute I hate you. And so I used to think, right,
Right.
you know what I'm saying? It's like, so I think we have
Mhm.
to understand it's our hormones, because I would think like, is there something wrong with me? And I think I hear that from a lot of women. It's like, is there something wrong with me? mentally or something. Why do I feel this
Right.
way at the moment and in the next another part of my cycle? So definitely we need to educate ourselves, definitely. So we're not hard on ourselves and thinking there's something wrong with us, or then our husbands or people in our life think, "Well, this one, you're crazy. What's going on?" That everybody can understand.
Mhm. For sure. I agree.
But with that said, any last minute anything that you'd like to add?
Just the last thing I want to say, this is something we say amongst our community when you talk about recognizing your body, trying to understand those changes. We say give yourself G and G, which is grace and gratitude. So give yourself grace for where you are and the things that aren't perfect or where you want it to be. And then have the gratitude for where you are, what your body is capable of doing. And again, just remembering that your body is divinely designed and has a great capacity to heal.
Oh, that's awesome. Fantastic. I love that. Definitely have grace and gratitude. And definitely, yeah, you got to find the good in everything and accept it
Yes.
all. Well, thank you again, Dr. Michaela Woods, for joining us here on the Fit and Fueled by Faith podcast. Definitely appreciate your time and sharing your information with us. And again, we will link all that information or anything you want me to link to the show notes. And it's been a pleasure. So thank you so much. I think I learned a few things today, and hopefully my audience that if you haven't heard of this, then this is something you could take and listen to it again. And maybe if you know somebody, if you're not going through anything right now, you could share this with anybody in your world that you know that can use this if they're having symptoms or similar symptoms that you've heard us talk about. And just generally, I think anybody could listen to this that really just wants to educate themselves and to understand their body better. Appreciate you sharing. So again, thank you so much, Dr. Woods. We appreciate you, and thank you so much for being on the show.
Thank you for having me.